and cardiovascular incidences. So we want to monitor heart functioning, and if we have a supplement that might help with energy and also might help protect your heart, bam, there you go. Another one I could have put on here is something called coenzyme Q10. CoQ10 is an antioxidant that also has been shown to help protect the heart. American ginseng. This is the most common energy stimulant that people have heard of. And by stimulant, I mean it's something that you could take on an as-needed basis because it does have more of a short-term or immediate effect. It doesn't solve the problem of why you're depleted like the B vitamins do. It's simply something to use if you need a little boost and get you through the afternoon. And it comes in teas, it comes in supplements, tinctures, capsules, you name it. American ginseng is probably one of the more common things you'll see in the energy supplements that are at health food stores or even gas stations. You'll see kind of the things that try and keep people awake. A lot of the energy drinks that are out there that the younger population, I just think they're more of their generation, the younger population is drinking those stimulant energy drinks. Ginseng is often an ingredient in there. Something else to consider for fatigue is IV micronutrients. So we can use these vitamins and certain nutrients in food forms. We can use them in liquid forms, in tinctures and other liquids. We have them in sprays. We have them in supplements, capsules, tablets, teas. We can also use them intravenously, which is making up, a personal cocktail of nutrients and utilizing an IV. The benefit of utilizing IV micronutrients or we can deliver, I do often B vitamins, B complex, magnesium, and vitamin C, is what happens when you get an infusion that goes directly into your blood, you have guaranteed absorption. When we take these things in supplement, capsule, other forms, we're relying on our digestive tract and the health of our digestive tract to absorb and assimilate the minerals and make sure they're going into the tissues that they need. Obviously, IV micronutrients are contraindicated at certain times of treatment and with certain treatments, but I do use it quite effectively. It's a painless procedure. This is also going to give you a more immediate effect, and similar to acupuncture, I typically would recommend one infusion at least once every 2 weeks for a cycle of 4 to 6 infusions to really gain the largest benefit. You can boost your food or your energy through food and nutrition. So there's energy-packed foods. This is not rocket science. I'm not here to tell you what foods have energy and what don't. The simplest way to look at it is we know the most nutritious foods are fruits, are vegetables, are whole grains, are lean proteins, our whole foods type of diet has the most energy-packed foods. Nuts, seeds, nut butters, almond butters, peanut butters, cashew butters. They're very energy dense, which means you get a lot of bang for your buck. A tablespoon of a nut butter is going to give you more nutrients than a Snickers bar. And it's going to give you more energy than a Snickers bar. So when I talk about food and nutrition, food is your best medicine. Food always needs to come first. It doesn't replace, I can't eat a fast food diet and say, oh, but if I take this pill, I'll take my B vitamins, I'll be fine, I'll have energy. What I recommend is 90% of the time, eat nutritious foods that are fueling your body, and that's those whole foods. The other 10% of the time, it's not going to matter. So that's when you think about, these cookies are looking really good to me right now. I've eaten well throughout the day. I haven't met my quota yet of non-nutritional food, so go for it. Give yourself leeway. You're never going to have a cheeseburger, bacon cheeseburger, and French fries ever again. But if you're eating salmon and chicken and your vegetables Monday through Thursday, Friday, go out, have a burger, have a steak, do whatever it may be, because your body will be able to compensate for that, because the majority of the time it's getting the nutrition and energy that it needs. Regulation of dietary supplements I have to bring up because some people are aware, some people are not, that these are not regulated like pharmaceuticals and drugs are, which means there's hundreds of brands out there. Very few of them test for purity and quality, fillers, binders, contaminants, toxins, fungicides, mercury, you name it. So it's not only important to customize the recommendation of the plan of what you're going to take, then you have to take it to a whole nother level and say, okay, now I know I want to take some B vitamins. What the heck brand do I buy? And you can go to Amazon, you can go into PCC, Whole Foods, a Pharmaca, Integrative Pharmacy, Fred Meyer, and you'll see there's 10 different brands of a B vitamin. They're all in different doses. They might have all different ingredients. I don't know if they're testing the product. So there are certain brands that are physician branded or that we would recommend because I know and I've been assured that they test for purity, quality, no unnecessary ingredients, and all that junk that you don't want in there. So if you've tried something, let's make sure you're spending your money, you're taking the time to invest in these and incorporate them into your lifestyle and behavior and take all these pills. Make sure you're taking something that's been proven to be beneficial and safe. These are some of the brands that we stock in our clinic. This is a short list. I also use a company called Full Script that they carry the top, I think it's 100 physician brands, because there's different products I like to go for different companies. For example, this glutamine powder, Claire does a good job. I use Pure Encapsulations. I use a company called Vital Nutrients. Vital Nutrients, this one here, they have a brand and different formulas that naturopathic physicians, including myself, have specifically formulated. So this formula, for example, is BCQ, which has bromelain, curcumin, and quercetin in it. It's highly anti-inflammatory. It works great with, if I'm trying to look to control inflammatory pathways, so I use it a lot with my patients. This one, UroPro by Douglas, is to help with urinary symptoms, frequency, urgency, incontinence, leakage, change in stream. Does not help erectile dysfunction. It's more helping the urinary complaints and trying to strengthen those. This is something that I use in conjunction with Flomax, for example.
What are the ingredients of that one?
It is lengthy, and I should have brought my glasses here. Vitamin A, vitamin E, B6, zinc, pygeum, pumpkin seed, glycine, L-alanine, glutamic acid, and grapefruit extract, and saw palmetto. So those ingredients are what you have there is amino acids and herbal medicines that have all been shown to help support healthy urinary function, specific to due to enlarged prostates.
Thank you.
Where can you buy that, by the way?
This one from Douglas Labs you probably could find online. Again, it would be something that, because especially you notice how many ingredients, it might be one ingredient that would not be safe for you to take. But saw palmetto is probably, and pygeum are probably two of the most common ingredients that you'll see in most prostate formulas. This is not fighting prostate cancer. This is simply helping to manage the urinary symptoms due to prostate cancer or enlarged prostate.
Perhaps a store like Marlene's would have that.
They may. I don't know what, I'm not familiar with them and what brands that they carry.
Thank you.
Where do I hold this? Is it better? Yeah. Okay. So here's some when you want to, if you say, okay, well, what do I, at least give me some help here. What do I look for? You want to look for products that are tested for potency, quality, contaminants. Some have what's called a GMP stamp on them. There's a new stamp that's just coming out too. You'll start to see that. GMP stands for Good Manufacturing Processes. All that means is it's manufactured in a clean facility and factory. It doesn't mean the ingredients on the inside are clean. Companies that follow the USP standard are helpful and kind of give you an indication that they are more clean in a product level. If they put on their label, this product contains no wheat, sugar, gluten, fillers, additives, colors, contaminants, tested for mercury, mercury-free, that's usually an indication that they're looking at. If they're looking at it deeper than someone that's not, someone that doesn't test for that is not going to write that none of these are included in this product. Again, I have mentioned throughout the entire presentation, you always have to be aware of drug-nutrient interactions. Just because they're natural, it doesn't mean they're safe, and it doesn't mean they're safe to take with certain pharmaceuticals, high blood pressure medications, high cholesterol medications, and many other pharmaceuticals out there. Here's a supplement label. I wasn't sure how familiar people were, but so what you want to look at, a couple things I'll just point out. Oh, and there's a pointer on here, right? Aha. So up top you have the supplement facts. The first thing you want to look at is what's the serving size. The serving size tells you one tablet contains all of this in these milligram or unit doses, and here's the percent of daily value. As a naturopathic physician, what I can tell you, don't waste your time looking at these percentages. The reason why the recommended daily allowances, these percentages were based on healthy populations and what the minimum amount that was needed for the majority of the population. So I'll give you an example. When we look at vitamin D on here, one tablet contains 400 international units. Okay? If I go across, that's telling me that that is 100% of my recommended daily allowance. How many of you take vitamin D? How many of you take 2,000 international units or more? Okay. 2,000 international units of vitamin D is a maintenance dose that's been shown helpful for immune support and bone health. So if you look at, if one tablet contains 400 units, I already have to take 5 of these tablets to get to what my recommended therapeutic dose of vitamin D is. So you always want to look at the milligram or international unit doses. That's how you should be taking supplements, which is often why I pull ingredients out, because I want to use them at therapeutic doses and not affect. If you get 5 tablets of that, then if you look above that, vitamin C is at 417% with one tablet. So times that by 5, you're at 2,000% of what you need. So you kind of affect the other ratios. Take things in milligram or unit doses, not based on recommended daily allowances. And then the other quick thing I'll point out, if you look at, when you take a supplement, you want to take it for what these active ingredients are. Okay? So vitamin D, I want to look at a label and I want it to say 2,000 units of vitamin D up here. And then see this, all this here in very small print, but you can see it's a lot of different words. This is other ingredients. These things are meaningless, unnecessary, often where your fillers and other things are. So if this list is long, then typically I say move on, go to somebody else. Especially if this list at the bottom here is long, when you only have a 1 or 2 ingredient formula up top.
Doctor?
Yes.
When you moved from Illinois to the Northwest, you realized we're in Costco country. So, does Costco do a good job of screening? Because they do a wonderful job of marketing vitamins.
Correct.
And typically the average person that has cancer says, give me vitamin D, give me calcium, give me lycopene. Do you have any feelings about that? I'm not trying to get you to get into a commercial.
I am in, you know how I learned that I was in Costco country is because I finally made the connection of, oh, Kirkland brand, Kirkland, Washington. I never knew that.
It took me 5 years.
Okay, so I'm a little bit ahead of the game there. So yes, I have learned that. The short answer to your question is some of the products that they have are good and would be beneficial and suffice, and some of them I would not recommend. I will further clarify that for you.
Okay.
When you look at something like vitamin D as a mineral,
Right.
it's inexpensive. Okay? It's one ingredient. So if Kirkland has a vitamin D supplement and it has 2,000 units on the label, that's going to suffice. Kirkland also has omega-3s in fish oil, as I'm aware. And I often have patients that like to purchase from there because they find that they're much less expensive. Fish oil is something I'm going to be much more adamant about quality from, because it's where are they extracting that omega-3? What is their source of fish? What's the potential contaminant? And if it's inexpensive, I'm personally questioning the quality and the source, because I know you can't get that good quality unless it's full of mercury, or not full of mercury at that price. It's physically impossible. The market doesn't allow for it. But a simple mineral, calcium, vitamin D, magnesium, single ingredient formulas, they're not going to mess with because it's not worth their time. And we can all buy them inexpensively. CoQ10 is another example. CoQ10, by nature of what it is expensive for a quality source in a regulated dose. So when I have a patient that tells me the CoQ10 that they purchased was 1/3 the price at Costco, I'm concerned about the quality, because you can't, I buy from wholesalers, I can't get it at that price. So depends on what you're buying from there. You just got to be picky and choosy, and finding the most economical way to do this. The other thing I talk to patients about, and people find this interesting because as a naturopathic physician, I prescribe supplements. You know what I spend a lot of time doing, more so than I do prescribing?
Researching.
Not prescription, but yes, I do. I take my patients off a lot of their supplements for a lot of different reasons. You know, I have people come in with bags and suitcases and, 20 different pills they're taking. And the reason I do it is because you want to emphasize and prioritize what are the top 5 to 10 things that you need right now in this phase of time, in this phase of treatment, and kind of moving forward. Those things change. If you have surgery for your prostate cancer, what I'm going to have you take during surgery and the healing, 4 to 6 weeks after surgery is going to be very different than when you start androgen deprivation therapy and radiation. Then I want to focus on those things. And it's 8 weeks later, you finish radiation. Okay, so I want to adjust. So you always want to prioritize what's the highest needs of what are the things that you need to do right now. So taking more is not always better. And I emphasize that because then I also have conversation with people and say, well, you know what? This is really important at this point in time, and here's the reasons why. So maybe let's prioritize the quality of this product right now, and then knowing you're not going to be on it for the rest of your life spending $30. You should never spend more than, let's say, for one supplement, should be around about $20 for a month supply. Should be $1 or less a day for one thing. So if I put someone on 5 bottles of something, I'm not expecting them to pay more than $4 or $5 a day for that, which in my references, I can't get a latte out of any of these coffee shops or Starbucks for less than $4 or $5 with almond milk. So it's a good, you invest in your health and you prioritize the things that are most important to you and most therapeutic to you.
As a medical professional, do you believe that organic fruits, vegetables, make a big difference to the person that's a cancer survivor?
I think we have seen the quality of our food supply, the quality of our soil being rich in nutrients,
Right.
and we have seen pesticides and other things and how they damage food sources.
Right.
If you have an option and it's conducive to your lifestyle, and you have access to organic, free-range, pesticide-free, grass-fed, all of those, or any combination of those, if that is an option for your lifestyle and you have access to it, then I do encourage it. Because the food, when we damage it with those other things, less nutrients in the soil, throw some pesticides on it, you're just depleting it of nutrients. Now, I say that with caution because that's not always an option for a large portion of the population. You have much better access to healthy food.
Yeah, PCC is alive and well here, and you probably run into that in your time here.
And PCC it's expensive, so then again, I pick and choose. I will go and, I'll buy certain things from Whole Foods, and buy, meats. Oh, look, this free-range chicken is on sale, and it's still in date. Well, I'm going to buy a little bit extra. I'm going to throw some in the freezer because it's on sale right now. Same thing with PCC. PCC it's more expensive, but I'm hesitant to say that because I have had patients where that's not an option for them, and they don't have access to it. That's very different here. You have access to much healthier food. So if your lifestyle and behaviors, if that's something that's conducive, then I do encourage that.
Thank you.
Yeah.
How does ADT affect enzymes?
Digestive enzymes, or what type of enzymes?
Liver, I don't know. I did either. When I did that work with my enzymes, they were off.
Oh, what enzymes in your lab work?
Yeah.
Which, your liver enzymes?
Yeah.
Liver function, ALT, AST?
Yeah.
Yeah. So I can't give you any specific medical advice, but what you can see, the changes that happen with the lack of testosterone is your body goes through a lot of changes on a cellular level. We talked about that weight gain, which could cause potential to increase enzymes or inflammation in the liver. Those enzymes are non-specific markers for liver inflammation, so inflammatory pathways could be up, not detoxifying. Different medications, prescription medications, can elevate liver enzymes. So I can't say specifically for you why they went up.
Well, one thing I'm saying is that when they did the blood work months ago, I was okay. Then I took this stuff, and then this happened. So I'm trying to kind of correlate the two. Because before that, I was fine. And then they did the test after I'd done this Lupron and radiation. And then when they did the last one, that's what happened.
Yeah.
So now I'm just trying to ask you, have you ever seen anything like that?
And so you have to look at that. It's the physical changes on a blood work and how the blood work can change. And those are things that definitely need to be monitored and need to be addressed and further worked up. So typically what I tell people, if you were my patient, we go through, we look at the lab work, we would I'd look at your review of your medications and treatments you've been under, and then try and determine what the cause was, and then treat it. And if you don't treat it successfully, you got to keep digging deeper to find out what caused it. But I can't speak specifically to you because I can't give your patient-physician confidentiality, as well as I can't give medical advice.
Well, that's true.
But yeah, there are many reasons.
Have you ever heard of it? Okay. So I'm going to follow up with my physician, of course, I will, but because they give me that.
Yep.
I'll just,
And the other thing we look at too is there's other changes that can happen in life that could be happening for other reasons, not due to prostate cancer or the treatments of prostate cancer. So you always want to have everything worked up to make sure it's not, if it is just due to the treatment, great, they can solve that, resolve it. If it's not due to the treatment, well, what else is going on that needs to be addressed? Another disease, another illness, another symptom. So don't just always assume that it's because of ADT.
Last question, you talked about weight gain. That's part of the ADT.
It can be, and it's more specifically, it's due to loss of muscle mass, and then it can be weight gain in generalized weight gain, but also weight gain in areas that men don't typically gain weight, in the breast area, for example. And that's due to the hormone changes in how the muscle mass is
Right,
defined.
okay, that I can correlate to the drugs.
Correct,
That one I'm okay because it's, you know, I've seen it happen,
correct.
yeah.
Yes,
You didn't
Yeah.
mention life extension. Any thoughts one way or the other about life extension?
so like, I don't have any allegiance with any supplement companies or pharmaceutical companies.
Nor do
So
I.
I will start there. I have nothing to disclose as far as I don't benefit, I don't consult for any of them. So my opinion is take it for what it's worth. Life extension makes good quality products. They're clean, they don't have a lot of unnecessary ingredients. Those are the positive things. On the other side, the two things I've noticed is they're expensive for what you're getting. And what I found is I've looked at different, and specifically there's a urinary formula that Life Extension uses that a lot of men come into me on. And when you look at the ingredients and specifically look at the milligram doses, they're paying a lot more, and we can get them just as clean of a product at a much better price. But Life Extension has a reputation. They promote their quality products, and they've done a wonderful job marketing. I don't have anything bad to say about them as far as they're not putting fillers and junk in their stuff. I just think if you look at the milligram dosing, we can get you just as good a quality at a little bit better price. They also have some of their lines, I mean, they have hundreds of thousands of products. I've gone through their brochure.
They certainly do.
They have, the other thing they've done is they've tried to do a lot of combination products, which means put as many ingredients as you can in. And in my practice, it's hard for me to use those because I try and pull out specific things. So it's the combination, there might be one or two ingredients of why someone can't take that formula, but the other 12 ingredients would be fantastic if I could get them in them. So they're not very specialized products, but for general health, prevention and wellness, they've done a great job.
The other question about vitamin D3, should I seek a level?
Yes, absolutely. So vitamin D3 that we've talked about, how much someone takes should be based on your blood level. And it's a simple blood test. Anytime you're having your blood drawn, or you can go in if you want to get stuck just for that, but I say anytime you're having routine blood work, PSAs, CBCs, chem screens, you name it, ask your physician to check your vitamin D levels. You need them checked about once a year. They're not going to change very quickly. And typically what we'll do is we'll dose, what the evidence shows is to gain health benefits, bone health, and immune system support, you want your number to be about 50. The range is 32 to
50.
50.
Okay.
Goal number. I love it. I just say go for 50. If you get around there, you're golden. The range is very big. It's 32 to 100. So if your level comes back deficient, 20, we'll say, deficient in the range, you need to take a dose that's going to correct for deficiency and support bone health and immune support. So it's going to be a higher dose until you're no longer deficient. And that's the point. Then when you retest in a year, if you're no longer deficient, you drop the dose down to a maintenance dose, which is a lower dose, where you still gain health benefits. The other thing while we're on vitamin D, we do not get the active form of vitamin D from the sun. We don't convert it into the tissues to gain the benefits. So even the people that live in the sunniest of climates that have 12 hours of sunlight 325 days a year, not here, I'm learning, they are still deficient. So it is something to test for. And it's a very simple, most physicians do it if